Hello! Today we will look at such an interesting topic as vitamin A hypervitaminosis in cats. We learn why vitamin A, which is vital for cats' health, can also be dangerous for them. Today we're discussing excess vitamin a condition we see in practice far more often than deficiency. Let's look at why, for a cat, the line between essential and toxic is much thinner than you might think. And why is this essential nutrient causing so many problems? And what are the hidden risks for your pet? Before we delve into the dark side of vitamin A, let's break down the essential physiological functions that make this molecule indispensable for every cat. Let's start with the impact on vision. Retinol is a precursor to rhodopsin, the primary pigment in the retinal rods. Its deficiency leads to nyctalopia, or night blindness. This is a critical impairment for a species evolutionarily adapted for nocturnal predation. Also, vitamin A is important for the feline immune system. It supports the barrier function of mucous membranes and stimulates the production of antibodies. Next is epithelial differentiation. Vitamin A maintains the integrity of the mucous membranes in the gastrointestinal, respiratory, and urogenital tracts. This vitamin affects reproductive function, as it is necessary for normal spermatogenesis in male cats and for the maintenance of pregnancy in female cats. Vitamin A influences the activity of osteoblasts and osteoclasts, which is critical for the proper development of kittens. Finally, vitamin A is essential for maintaining iron homeostasis. It enables the movement of iron from liver stores. A deficiency may contribute to secondary microcytic anemia. We have just seen how vitamin A acts as a vital architect of feline health, but in the world of biology, even the best things can become destructive. There is a hidden threshold where this essential nutrient stops being a healer and starts acting as a silent architect of deformity. In cats, this transition is particularly dangerous because their bodies lack the safety valves that other species have. Now let's look at why cats find themselves in trouble with vitamin A. It's all about their unique metabolism. On one hand, we have deficiency. This usually happens because people forget that cats are obligate carnivores, whereas, for example, dogs are facultative or adaptive predators. In more detail, we examined these features in the previous video, link in the description. And now let's return to vitamin A. You can feed a cat all the carrots in the world, and it will still suffer from vitamin A deficiency. Why? Cats lack the intestinal enzyme beta-carotene dioxygenase and cannot convert plant-based carotenoids into active vitamin A. They require preformed vitamin A, called retinol, which is found exclusively in animal tissues. But unlike other species, cats lack a metabolic brake, leading to the unrestricted intestinal absorption of vitamin A, regardless of how much is already in their system. As vitamin A intake continues, the liver's storage capacity is quickly overwhelmed. Consequently, the excess enters the systemic circulation in toxic concentrations. Therefore, we can conclude that cats cannot synthesize vitamin A from plant-based carotenoids, nor can they stop absorbing it from meat as preformed retinol. Now let's look at the primary causes of this toxicity. It usually stems from three main sources. First, the liver-only diet. Many owners mistakenly believe that feeding raw or cooked beef or chicken liver as a primary meal is healthy. In reality, this provides a massive, dangerous dose of vitamin A. Second, fish liver oils. Owners often supplement their cat's diet with cod liver oil to improve coat quality. However, without professional guidance, this leads to chronic over-supplementation. And finally, human multivitamins. Supplements designed for humans have much higher concentrations than a cat's body can handle. One small tablet for us is a toxic overdose for them. Unlike many toxins that trigger an immediate reaction, vitamin A has a cumulative effect in the animal body. Consequently, the disease may only manifest after several months or even years of chronic intake. Besides the fact that cats are particularly susceptible to vitamin A toxicity, the pathophysiological sequelae of this chronic disease are quite unique. While other species might show general signs of malaise, liver damage, or skin changes, in the feline patient, the response is distinct and far more specific. Cats possess a unique ability to transport large quantities of retinal esters within blood lipoproteins. While this protects their liver from immediate cirrhosis, unlike in humans, it constantly bathes the skeleton in high concentrations of active vitamin A. The feline liver acts as an incredibly resilient storage site, but this protection comes at the expense of skeletal health. Now let's focus on the skeletal system, which is the primary target of this toxicity. The process begins with osteoblast overstimulation. Excessive vitamin A acts as a chemical trigger, causing these cells to initiate uncontrolled bone formation where it doesn't belong. This leads us to a hallmark of the disease, cervical spondylosis. You will observe the formation of bony outgrowths, or exostoses, along the occipital bone as well as the cervical and thoracic vertebrae. As these outgrowths bridge together, we see ankylosis. This is the literal fusion of joints, resulting in a permanent, irreversible loss of mobility, most notably in the neck and forelimbs. In advanced stages, these lesions extend further down. The elbow joints are frequently affected, often becoming completely fused in a flexed position. At this point, the cat's posture and movement are profoundly and tragically altered. When the skeletal changes become severe, the clinical presentation is impossible to ignore. We see two hallmark signs. Look for the kangaroo posture. The cat sits on its hind legs because the cervical spine is effectively welded and the forelimbs are locked in flexion and too painful to bear weight. Hygiene failure. The locked neck and restricted limb mobility make grooming physically impossible. What you see, a matted, dirty, or neglected coat, is not behavioral laziness. It is a direct consequence of severe physical limitation. While the bones are the most visible victims, the pathological impact of chronic hypervitaminosis A extends deep into the soft tissues and organs. Simultaneously, we see progressive organ dysfunction. The liver, despite its resilience, eventually succumbs to chronic metabolic stress, often leading to liposis. The kidneys are also under constant pressure as the body struggles to manage the mineral imbalances and metabolic byproducts. Beyond the liver and kidneys, chronic toxicity triggers a dangerous endocrine disruption. The excess of vitamin A interferes with thyroid function and creates a pathological synergy with vitamin D pathways, severely dysregulating calcium metabolism. This metabolic chaos leads directly to vascular calcification. As calcium is improperly mobilized, it deposits within the blood vessel walls, causing structural damage and loss of elasticity. Excessive vitamin A also impacts the nervous system. Increased intracranial pressure due to impaired cerebrospinal fluid absorption, leading to chronic headaches and irritability. In the eyes, we may observe retinal degeneration or corneal changes in extreme chronic cases. Furthermore, the gastrointestinal tract often suffers from chronic mucosal irritation, resulting in persistent diarrhea or constipation. Cats are often immunocompromised. Their bodies are so focused on managing the metabolic toxicity that their immune response to simple secondary infections is significantly weakened. The most common question from owners is, how much liver is safe? For an average 4-kilogram cat, the limit is strictly 30 to 40 grams per week. However, these numbers may vary depending on the cat's weight and basic diet. Crucially, you must advise clients to split this amount into 2 or 3 small portions. The liver should always be treated as an occasional delicacy, never as a staple. In addition, the liver of different animal species can vary significantly in vitamin A content. Note that beef liver contains significantly more vitamin A than chicken liver. When educating owners, remind them the line between a nutritious treat and a skeletal catastrophe is remarkably thin. We must also address a common owner mistake, the misuse of fish oil. It is vital to distinguish between fish body oil and cod liver oil. While body oils are safe sources of omega-3, cod liver oil is a vitamin A bomb. Just 1 teaspoon of cod liver oil can contain about 5,000 units of vitamin A. If an owner adds this to a diet already rich in liver, they are effectively fast-tracking the cat towards systemic toxicity. A final warning for pet owners: never use human multivitamins for cats. The concentration gap is massive. A single human tablet can contain more vitamin A than a cat should receive in an entire month. Combined with the risk of xylitol toxicity or vitamin D overdose, these supplements don't improve health. They trigger a metabolic collapse. Always tell your clients, if it's made for humans, keep it away from the food bowl. I hope this information helps protect cats from the consequences of excessive love. As veterinarians, we often see that even the best intentions, when combined with a lack of knowledge, can be dangerous for a pet. Remember, love for our pets should always be guided by knowledge. Thank you for watching. Subscribe to the channel and stay informed for the sake of your patients.